In our last video, we discussed the silent signs of clogged arteries, the pain in your legs, the fatigue, the shortness of breath. Those are the symptoms of the blockage. But what about the villain causing the blockage? What about the invisible threat that is building up in your blood right now, with no pain at all? I'm talking about high cholesterol. In my medical practice, there is one number I check that tells me more about a patient's risk for a heart attack than almost any other. It's not their weight, it's their cholesterol panel. But here is the danger. High cholesterol has no symptoms, or so you've been told. Unlike the clogged artery signs, cholesterol doesn't feel like anything. It doesn't cause pain. It doesn't make you tired, not until it's far too late. But what if your body was sending you signals? What if it was leaving clues that you could see? I'm thinking of my patient, Maria, 60 years old. She felt fine. She was active. She walked every day. But when I saw her, I noticed a silent sign on her skin, right by her eyes, that told me her cholesterol was dangerously high before we even ran a single blood test. Her body was literally showing me the disease. I'm Dr. Anya, and today I'm going to share 12 signs of high cholesterol. Most of them are not feelings. They are physical clues you can see in your eyes, on your skin, and in your hands. And at the end of this video, I'll reveal the number one hidden sign in your blood test that most doctors ignore. A sign that has nothing to do with your bad cholesterol being too high, but is a far more dangerous warning.
We are going to start our 12 signs with the invisible ones. These are the risk factor signs. You cannot see or feel them as a symptom, but in my clinic, they are the very first signs I look for to determine a patient's true risk. They are the why behind the problem. Sign number 1, a family history of heart disease. The very first sign I look for isn't even on the patient. It's in their family tree. Think of your genetics as the blueprint for your body. If that original blueprint had a known weak point, if your father, your mother, your brother, or your sister had a heart attack or stroke before age 55 for men or 65 for women, this is a non-negotiable red flag. It means your risk is not the same as the general public's. Your body may be genetically programmed to either overproduce bad LDL cholesterol or, more commonly, to be less efficient at clearing it from your bloodstream. This is the first sign, and it's the one you cannot change. It's your body's blueprint. Sign number 2, high blood pressure. If you have been diagnosed with hypertension, this is a major sign that you must take your cholesterol seriously. In my clinic, I call high cholesterol and high blood pressure the partners in crime. They are a devastating duo, and they work together to destroy your arteries. Here's how it works. High cholesterol, the LDL, is the gunk. It builds up plaque, making your arteries stiff, hard, and narrow. High blood pressure is the force. It's the physical pressure of your heart straining to push blood through those narrow, stiff pipes. This creates a vicious cycle. The high-pressure force damages the artery walls, creating little nicks and tears. This damage then makes it easier for the gunk, the cholesterol, to stick and build even more plaque. They feed each other. If you have one, you must be tested for the other. Sign number 3 is a cluster of statistical signs, but they are critical. Your age, your sex, and your weight. Let's break this down. Age, as we get older, our liver, which is the body's cholesterol cleanup crew, becomes less efficient at removing LDL from the blood. Sex is a crucial one. Men are generally at higher risk earlier in life, but for my female patients, listen closely. After menopause, when protective estrogen levels drop, your risk for high LDL skyrockets to meet and often exceed men's. And weight, and I'm not talking about the number on the scale, I'm talking about where you carry your weight, specifically visceral fat, the hard fat around your belly that surrounds your organs. That fat isn't just sitting there. It's a hormone factory that actively pumps out inflammatory signals and disrupts your body's ability to manage cholesterol. So, those are the invisible risk factor signs. But what if your body was giving you visible, physical clues you could actually see? That's what we're going to cover next. The signs in your eyes, on your hands, and on your skin. And it's exactly what my patient Maria had.
All right, we've just covered the invisible risk factor signs. But as I mentioned in the introduction, what if your body was giving you visible, physical clues you could actually see? This is exactly what I saw in my patient Maria. This brings us to group 2, the visible signs, the clues high cholesterol leaves on your skin. Sign number 4 is Xanthelasma, pronounced Xanthelasma. This is the sign my patient Maria had. She was 60 years old, felt perfectly fine, walked every day, but when she came in for her physical, I noticed small, yellowish, soft bumps near the inner corner of her eyelids. She told me, "Oh, I've had those for a few years, Dr. Anya. I thought they were just skin tags or part of getting older." I had to explain to her, "Maria, that is Xanthelasma. That is not a skin problem. It's a cholesterol problem. These bumps are not skin tags. They are literal, physical deposits of cholesterol building up under your skin. It's a direct visual sign that your body is so overloaded with lipids, or fats, that it has to start storing them in any place it can, including your skin." We ran her blood work, and just as I suspected, her LDL, the bad cholesterol, was sky high. Her own body was screaming a warning right on her face. Sign number 5 is also in the eyes, and it's one you can look for yourself. It's called Arcus Senilis, pronounced Arcus Senilis. This is a blue, white, or light gray ring that forms around the outside of your cornea, the colored part of your eye. Just like Xanthelasma, this ring is also a cholesterol deposit. It's another sign that there's so much excess cholesterol and fat in your bloodstream that it's beginning to deposit in the tissues of your eye. Now, in very elderly patients, 80s or 90s, this can be a normal part of aging. But if I see this ring forming in a patient under 60 or even 65, it is a major red flag. It tells me, as a doctor, that their cholesterol has likely been dangerously high for a very long time. Sign number 6 is the big brother of Xanthelasma. This is called xanthomas. These are similar to the deposits on the eyelids, but they are typically larger, firmer, waxy, yellowish deposits that can appear on other parts of your body. The most common places I see them are on the knuckles, the elbows, the knees, or, and this is a critical one, on the Achilles tendon just above your heel. These are not calluses. They are not harmless bumps from an injury. They are large, localized deposits of cholesterol. If you see these, it's a sign that your high cholesterol is not just a borderline issue. It's a significant, long-term, and dangerous problem that requires immediate medical attention. It's your body's final, visible attempt to warn you.
We've covered the invisible risk factor signs and the visible signs on your skin. Now we must talk about group 3. And I need to be perfectly, unmistakably clear. These are what I call the too late signs. These are no longer silent clues about high cholesterol. These are loud, painful symptoms that your high cholesterol has already done its job. It has already caused the disease we all fear. Advanced, dangerous atherosclerosis, or clogged arteries. If you are feeling any of these, you're not at risk for a problem. You are in the problem. This is the crisis stage. Sign number 7, chest pain, or angina. If you are feeling this, it's a sign your cholesterol has already built up so much plaque in your coronary arteries that your heart muscle itself is being choked. This is your heart muscle screaming for oxygen. It's the pressure, the squeezing, the elephant on your chest we've talked about. This is not a warning for a future problem. It is a current, active crisis in your heart. Sign number 8, pain in your legs when you walk. As we discussed in our last video on clogged arteries, this is intermittent claudication. This is angina for your legs. It is a definitive 100% sign that your cholesterol has built up so much plaque in your leg arteries, what we call peripheral artery disease, that your muscles are starving for blood. If the plaque is in your legs, it is guaranteed to be in your heart. Sign number 9, stroke symptoms. This means a sudden numbness or weakness on one side of your body, a droopy face, slurred speech, sudden confusion. This is a TIA, or mini stroke. It is a sign that your high cholesterol has clogged the carotid arteries in your neck to a critical point. A piece of that cholesterol plaque has broken off, traveled to your brain, and temporarily cut off your oxygen supply. This is a 5-alarm fire. It is a medical emergency and a sign a massive, permanent stroke is imminent. Sign number 10. Dizziness and persistent crushing fatigue. This is a sign your heart is failing under the strain. The cholesterol-clogged arteries are forcing your heart to work overtime, like a pump trying to push sludge through a narrow pipe. It's failing to get enough oxygen-rich blood to your brain, that's the dizziness, and it's failing to get enough oxygen to your body, that's the fatigue. You are not just tired, your heart is tired. And this all leads us to sign number 11, which is the only truly silent sign on this entire list, the blood test itself. This is the only way to catch this silent killer before you get to the too late signs we just discussed. But just getting a test isn't enough. You have to understand what it means. We look at LDL, the low-density lipoprotein. This is the bad cholesterol. Think of it as the delivery truck that dumps cholesterol plaques in your arteries, clogging them up. We also look at HDL, the high-density lipoprotein. These are the good cholesterol. These are the garbage trucks that remove the bad cholesterol from your arteries and take it to the liver to be thrown out. Most doctors just focus on the delivery trucks, but I had a patient, Robert, who came in with normal total cholesterol. He thought he was fine, but his garbage trucks, the HDL, were dangerously low. He was all delivery trucks and no cleanup crew. And that brings us to the most important and most ignored sign of all. And now, as I promised, we've arrived at the number one hidden sign of all. We've spent this whole time talking about your bad cholesterol, LDL, being too high. But the sign that is most often ignored, the one that can be just as or even more dangerous, is sign number 12. Your good cholesterol, HDL, is too low. Let's go back to that analogy I just mentioned. Think of LDL as the delivery trucks. Their job is to deliver cholesterol, plaque, to your arteries. Think of HDL as the garbage trucks. Their entire job is to drive around, find that bad LDL cholesterol, pick it up, and carry it back to your liver to be thrown out. Your HDL is your cleanup crew. It's your body's natural defense against LDL. This is exactly what I saw in my patient, Robert. He came in with a normal total cholesterol number. His doctor had told him he was fine. But when I looked at his full lipid panel, I saw the real story. His bad LDL was borderline, but his good HDL was dangerously low. He had a full fleet of delivery trucks dumping plaque everywhere and almost zero garbage trucks to clean it up. You can have a normal amount of bad cholesterol, but if you have no cleanup crew, that plaque just sits there. It builds up year after year, clogging your arteries. Having low HDL is one of the most dangerous and underappreciated signs of all. It's a sign that your body's natural defense system has failed, leaving you wide open for a heart attack. So, you've seen the visible signs, and you now understand the hidden danger of low HDL. If you're looking at your own skin with worry, or you're pulling up an old blood test and feeling more confused than ever, the very first thing I want you to do is take a calm, deep breath. This is not a death sentence. It is a warning light.
And a warning light is a good thing. It means we can fix the problem before it becomes a crisis. Here is your 3-step plan. This is what you do now. Step 1. Get the right test. First, a total cholesterol number by itself is almost useless. It tells me nothing. You must ask your doctor for a full lipid panel. This is the test that breaks down all the numbers we need. Your LDL, the delivery trucks, your HDL, the garbage trucks, and crucially, your triglycerides, another type of fat in your blood. Step 2. Understand your ratios. This is the secret. This is what I really care about in my clinic. Stop obsessing over your total number. I want you to look at your triglyceride to HDL ratio. This ratio is the true marker of your heart disease risk. Here's how you do it. Take your triglyceride number and divide it by your HDL number. If your ratio is 2 to 1 or less, that's excellent. If it's 3 to 1, that's a warning sign. If your triglycerides are 150 and your HDL is 30, your ratio is 5 to 1. That is a 5-alarm fire, even if your total number looks okay. This simple ratio tells me everything about the balance of fats in your bloodstream. It tells me if you have too many delivery trucks and not enough garbage trucks. Step 3. Send in the garbage trucks. So, how do we fix this? You're not a victim of your numbers. You can fix this. The goal is not just to lower your bad LDL. The goal is to raise your good HDL. You need to send in more garbage trucks to clean up the mess. How do we do that? We add the right foods. We fight fat with fat. We add monounsaturated fats from avocados and olive oil. We add omega-3s from fatty fish like salmon or from walnuts and flax seeds. We add soluble fiber from oats, beans, and apples. These foods are the fuel for your cleanup crew. They actively help your body raise your HDL, lower your triglycerides, and start the process of cleaning out your arteries starting today. So as you can see, high cholesterol is a silent disease, but it is not an invisible one. Your body is sending you signals. You just have to know where to look. On your skin, in your eyes, and most importantly, in the ratios of your blood test. You are not a victim of your numbers. You are the architect of your health. With this knowledge, you can now have the right conversation with your doctor and, more importantly, take the right steps with your diet to send in that cleanup crew and take control of your health. This is a conversation, and I want to hear from you. Have you ever been confused by your cholesterol numbers? Has a doctor ever just told you your total cholesterol was fine without explaining your HDL or your ratios? Or have you ever noticed one of these visible signs on yourself or a loved one, like the spots on the eyelids? Share your story in the comments below. Your experience could be the aha moment that helps someone else in our community finally understand their own health. If you found this valuable and want to continue to build your health knowledge, subscribe for our next appointment. I'm Dr. Anya Manasheka, and I'll see you in the next video.